Hi, I'm AJ Loiacono, the CEO of Capital RX, and I'm joined today with Holly Maloney, a partner with General Catalyst.
Hey, hi everyone. Good to be here with you.
Well, it's great to be here. We've had a very interesting 2022 with a combination of interest rate changes, geopolitical affairs, as well as just changes in general to the investment sector. So kind of what are some of the things that you've seen with 2022?
Yeah, I mean, 2022 has certainly been an interesting year for all of the reasons that you mentioned. But the reality is that as we think about our investing at General Catalyst in healthcare, healthcare is secular, not cyclical. So regardless what's happening with inflation and, geopolitical challenges, people are still sick. And our healthcare system is still broken, which is why we have a really clearly defined thesis around health assurance, which is making our system more personalized, proactive, at a lower cost, and more accessible for the most marginalized communities. And all of those statements are still a work in process, but it's why we have a dedicated team. We have a dedicated fund that invests in companies of all stages that are really addressing this thesis area, and we're still really actively investing. So even though if you look at the stats that Rock Health will release, that the third quarter of this year was, I think, the lowest funding quarter in 11 quarters that they've seen. We've still been really active. I recently made investments in companies like Maven Clinic in the women's health space, Ripple in the senior behavioral health space, Cartwheel in the K-12 behavioral health space. So we're still really actively looking for exceptional teams that are building enduring companies, because enduring companies should endure, and that means lasting through many different market cycles. And it's certainly why we invested in Capital RX in 2022. I think it was May or June.
Yes.
When the investment closed, is because Capital RX is so aligned with our health assurance thesis. We've been studying the PBM market for a really long time and have never found the model and the team that felt compelling to invest in. And, understanding the nuances and all of the challenges with that space from a transparency perspective, from a technology perspective, there really is no modern infrastructure to support, a fully transparent, lower drug pricing that we all need and should expect as consumers. So once we met you and your team, we just knew that this was absolutely the opportunity that we wanted to meaningfully invest in, again, regardless of the backdrop of the market.
Yeah, and obviously we're incredibly appreciative, because without strong partners, companies like ourselves can't tackle some of the biggest problems in healthcare.
Yeah. Well, speaking of 2022, I mean, what did you as the co-founder and CEO of a really fast-growing company in the healthcare space see as your biggest challenge over the last year?
Yeah, I think for us, let's start with the growth factor. Whenever you grow over 100% year over year, you obviously have a host of challenges in general with staffing, operational support. Your go-to-market strategy is refined as well, but I think it's also kind of leftovers from the pandemic, where we were originally 100% or close to 100% New York City-based organization. And we came in 5 days a week. It didn't matter if you were an engineer, salesperson, pharmacist. And then, we look at the accelerated growth, and suddenly we're in 31 states.
Wow.
And we're only about 35% New York metro region. And so we grew rapidly but apart, but how do you stay unified? So I always say that's one of the biggest challenges, because throughout my career, I always feel like staying in touch with all of your colleagues is so important, because you're constantly looking for who are your next gen leaders, who are your A players that are going to stand up and take on new challenges. And oftentimes these become your peers, over time in the organization, which is absolutely true historically for this organization and for other firms I've worked with. And so I think the greatest challenge for us, I just go back to, is hyper growth in kind of this disparate office environment that's also hybrid. So even when you can come into the office, you don't have to. And I think that's an important part, because I will say, even myself with work-life balance, I on some level was reintroduced to my family. And I think it's amazing that you have that opportunity and you do gain efficiency, but there is something missing, and I think that's something that we worked very hard through communication and training, and we're still solving for as we move forward, and it's something we'll probably still have to address in 23 and beyond.
Yeah.
So what are your biggest challenges that you faced in 2022?
Yeah, it's a really good question. Despite the tornado that is having 2 babies under 2, which is, a whole different set of challenges. But as I think about the business that we're in, one of my partners always says is that you need to define reality but give hope. And so really using that in the context of the environment that we're in, where you do really need to define reality for the companies that you're invested in, partnered with, in the trenches with, in terms of the economic backdrop of, a shift from the focus on growth at all costs to, what is the stability and, overall operating leverage of a business. We've definitely had to, kind of shift and sometimes educate for, younger first-time founders what that really means and how to set up the company, not just for the immediate term, but for long-term success. Because, as I mentioned, we look for companies that will endure, and the only way you'll endure is if you kind of survive this time and can, prosper under a slightly perhaps different financial model. But then also give hope, right? Because there is still no better time to be building a company than today, especially in healthcare, given the enormity of challenges that we're trying to solve. And so still making sure we're inspiring people to innovate, even if it might be, again, under a different set of circumstances, but to still be willing to take risk and, be willing to push the boundaries of the art of what is possible. It can be a tricky, dance to navigate, but it has to be the focus for us as a partnership. And we have that fiduciary responsibility to our LPs, which includes some of the health systems and endowments and pension funds, to ensure that the companies we're investing in can thrive. So AJ, over to you. I mean, it seems like there's been some real regulatory progress with the CAA and the Inflation Reduction Act. How does this impact Capital RX and the market opportunity for the business?
Yeah, so starting first with Consolidated Appropriations Act, it's kind of like this funny little bill that provided subsidy and relief in a variety of different areas in the country, but hidden in it on like page 500 something is this kind of disclosure for any self-insured payer around benefit compensation and benefit costs. And a lot of people don't understand that much of the self-insured industry is somewhat unregulated or underregulated,
right,
where it kind of falls under the Department of Labor, which is kind of a result of ERISA being written in 1974, where kind of it was authored by the Department of Labor. And so what was happening is that the country has obviously continued to expand and have runaway costs in healthcare. But no one had really started to think about all the different ways people are making money on healthcare. And there's never really been a disclosure set on this. I think if you look back historically, the Department of Labor did a very good job, because also what's contemplated under ERISA is pension and retirement funds. And those disclosures were really put in place in the start of the 21st century, which forced people in the investment advising and asset management business for retirement plans and pensions to start to disclose how they're making money. Because, not to oversimplify, there was a question: if someone's charging a loaded fee of 7% and the fund is only performing 3%, there's really not much value being delivered to that sponsor of that plan. And so the Department of Labor really didn't have the bandwidth, I think, not to speak for them, to tackle the healthcare side of the equation on compensation coming out of healthcare. And when you have a $4 trillion business, a lot of people are being compensated, rightly so, for their services. Perhaps some people being overcompensated. And here's the scary part: a lot of people are not disclosing, the full compensation. And so what the Consolidated Appropriations Act did is that I think it amended Section 408B2B of ERISA.
Who's tracking?
And it basically said, hey, each year, you, the fiduciary, the payer or sponsor of a self-insured plan, must ask everyone who's involved in your healthcare benefits what certain costs are. So there's a reporting structure, but more importantly, anyone who's making compensation, what are they making on these product offerings? And so this is the first year. And I think one of the things that's great about Capital RX is we want it to be future-proof from the start, is we don't make money on drug spend. We charge a flat administrative fee. So all of our value passes through to the end payer. But more importantly, when it comes time to report, we have an admin fee and ancillaries on clinical services that are all in the contract. So part of it is you not just have to state what your fees are, it has to be included in your contract, and you have to help report for this each year. And so this, I think, is going to slowly become a bigger and bigger thing. And I think we're very well positioned, because I don't want to say we saw the future, but I just couldn't believe the country could continue to operate the way it is when you have runaway healthcare costs, and we have the limited oversight on who's making money on healthcare services. And so I think we're very excited about that. The other one, the IRA, the Inflation Reduction Act, this is kind of looking long-term, starting in a variety of different areas in which the federal government can, being the largest payer in the country, rightly so, are there ways in which perhaps the federal government should get more? Or even more for less is a good way to look at it. And so, starting with the negotiation on Medicare, on, rebates on particular drugs. And, it starts with a fairly narrow list and it builds up to 80 or 90 drugs going into, I think, 2030. But I think the broad paint strokes of this is, for the first time, the government is really starting to lean in and ask for the value it should be, not just for the government that sponsors a large part of this cost, but more importantly for the patients being served under these programs. And so I think it's an amazing first step. I think, again, is it showing progress as an entire country, looking in the right direction. I know there'll be some friction points and there'll be some learning along the way, but again, it's signaling to myself that from a legislative and regulatory side, the government cares and is looking at improving all of these programs.
It is kind of amazing that this is just happening for the first time, but at least we're here. At least we're moving in the right direction.
Yes.
Progress. So I know we've chatted a lot about government programming. Can you just give a little bit more context as to how you think about the government side of your business and how that may impact the company going forward? Yeah,
it's probably our largest endeavor to date. And it's an enormous project that touches everyone from operations to underwriting to engineering, reporting teams. But the whole point of it is, when we started in this business, we recognized that we would begin with the commercial side of the business. Not to say that it's easy, but it's easier, certainly, than Medicare. And so when we entered the business, we obviously wanted to gain experience, build out our systems, but we always had this long-term outlook that over 5 years, we would build a platform that could process Medicare claims, Medicaid claims a little bit easier, but you could process Medicare claims. And why is this so important is, all the systems that are out there today literally were built before Medicare expansion. I mean, let that set in for a second. They were written 20, 30 years ago. They're very static systems that don't scale well. They barely contemplate the requirements for Medicare today. Forget about the future. So we always recognized there would be a point in time that we would want to and feel that we would need to address the third of the market that is government sponsored. And so we had a long-term outlook, and for us, over this last year and a half, from a build-out and capabilities, our Judy platform, which is our proprietary platform that adjudicates claims and system workflows, We had to invest an enormous amount of time to make Judy ready for government, but what Judy had a huge advantage with was a clean sheet of paper, which was, what are the workflows involved with Medicare? What can we do better? How do we make it more accurate, a better customer, patient experience? And I feel for us, it's so critical to help seniors in particular in Medicare program and give them a better service model, help them reduce costs. Be willing to finally offer the country a claim administrator that doesn't want to make money on drugs and just for a flat administrative fee wants to provide the best service, the best outcomes with the most accurate workflows. And I think this is what's been missing in a lot of our government programs and why we're so excited to enter the market in 2023. So I always like to, ask the question is, I think that we're a lot of things to a lot of different people, but I always want to hear from our investors and partners, what did you find that Capital RX was really addressing that was the most important, or certain elements that you felt that were critical in our model that the healthcare industry really needs?
Yeah, it's a great question. Because for many years I had been studying the PBM market and found myself making charts of the supply chain and trying to describe the market to my partners, and some of whom are focused on healthcare, some are not. And looking at sort of the incumbent players in the space, I realized that I got to a point where I couldn't stare my partners in the face and say, here's how all the dollars flow. This is, who's contributing what from a innovation perspective, from a value add perspective, and then be able to correlate the dollars that were kind of associated with those things in a really clear way. And how does this, at the end of the day, benefit the end consumer from a cost of care perspective and from an consumer experience perspective? And so what was so important for me, and why after our first Zoom call, because this was the height of COVID that we first connected, why I knew I wanted to partner with you and your team is because I could really clearly describe the technology innovation that you were bringing to a market that had not innovated from a technology perspective arguably ever, why you were very focused on transparency and having every stakeholder really clearly understand the supply chain and the pricing of drugs, and then really focused on the experience for the consumer. How is, whether it's a commercial life or a Medicare or Medicaid person, how are they going to be better off as a result of the innovation that you were bringing to the industry? And so all of those things were really critical for us as we think about A, our health assurance thesis, but then B, responsible innovation. Responsible innovation is a really important pillar for our firm. And I just felt so excited that I saw a company that actually was innovating in a really responsible way and bringing much needed information and data to a relatively historically stagnant market.
One thing we always think about is oftentimes when you're so focused on your own business is you may become a bit trapped in your own tunnel vision, that you're just thinking about how my business operates and are we making the right decisions. But I always think it's refreshing to hear, from the investor side and the advisor side, what do you think is really helpful advice for a new entrepreneur or someone who has, a small business that's expanding, be it looking for capital for the first time or maybe just trying to survive, some of the current market headwinds? What would you suggest?
Yeah, it's a great question. And, of course, sometimes the advice can vary depending on the stage of business or the business model. But overall, as I mentioned before, we were in this phase of, grow at all costs, grab as much market share as you possibly can in the shortest amount of time as you possibly can, and then figure the rest out as you go. And I think, as I talk about, as I speak with entrepreneurs today, especially that are focused on let's just say market by market expansion, right? Say they start in, one state and then plan to expand into other states from a coverage perspective. The advice of yesteryear may have been, enter all simultaneously, and then, you can figure out what's working and what's not, and pivot from there. And really the advice that I would give today is focus on being so excellent in your first market. And then, once you feel as though you're demonstrating that product market fit, think about, expansion in a reasonable way, because that's what you're going to get credit for today. You're going to get credit for demonstrating product market fit and a repeatable business model and a repeatable strategy at an earlier stage than you would have, kind of been held to a couple years ago. And I'm not saying that that's fair, because it's not, but that's just the reality of the situation. And making sure that you have the team in place that really complements who you are as an entrepreneur. Because team is everything, and through hyper growth, through downturns, through challenges, and that's not new information, but I think is now more important than ever to, make sure you have the right team and have the, a really transparent relationship with advisors, and, asking for help perhaps earlier than you would have before if it's ever needed. And I'd actually love to, turn that question to you as a successful repeat entrepreneur. What's the advice that you would give to founders today?
Well, I think you learn quite a bit over 23 years and counting. I always say, I call it bumping into the furniture in the middle of the night and remembering where the coffee table is, and you don't want to hit it again. So I think it's, first and foremost, you never stop learning, and even from your own mistakes. I think you hit upon a lot of some of the principles I've been taught or I've had to learn the hard way. So I think some of it is team is everything, so let's dig into that a little bit. Is first and foremost, you want a team that has alignment. So we're thinking big picture, we want to achieve the same mission, but we are individuals and we solve things different ways. So you don't want to micromanage people, you want to empower people, you want to trust people, because that's the only way you scale. But also, you want to hire your complements. You want to hire, effectively, you're interviewing your weaknesses. Right. Like, hey, be honest with yourself. What are your weaknesses? And who do you need to hire to shore those up? Because, everyone has them, and it's important to look at. But I think the other thing that you said that really stuck with me was demonstrate core competency in the market you start in. And for us, that was commercial, self-insured business. Do that at the highest level. Start with 500 life cases and move to 1,000 and 2,000 and 4 and 8 and 16 and 32. And one day you'll wake up and be in a great position where you could service pretty much any size payer in the country. But you couldn't have done it unless you demonstrated that excellence and you build that trust score, as I call it. No one's going to say, hey, go service this 100,000 life group tomorrow, because the first question is going to naturally be, what other 100,000 life group do you have? Right. And so I think for us, it was following, that very set of instructions you're mentioning, which is demonstrate that core competency, be successful, demonstrate repeatable business, but highly satisfied customers, and then move to something that is complementary. So our vertical is always payers, someone who's sponsoring or providing a plan. But we wanted to then move into government claim processing. Here's a third of the market that I think is underserviced. I think that there's a much better business model, both ethically from a pricing standpoint, as well as just better service and transparency for the patients. And so for us, it was take everything we learned in commercial and let's apply it to government and provide a better service offering. I think inevitably there comes a portion in any discussion when we say, what's happening next? What's going to happen in health technology, be it next 12, if you can, even 24 months. What do you think are kind of one or two of the trends that you think are really going to be important or happen during this time frame going forward?
Yeah, it's always the hot topic this time of year, heading into the holidays, as to how are we going to think about next year. And there are a few themes that I think a lot about, and we're still in very early innings of figuring out how to solve. One is the workforce transformation crisis. As you think about the state of health systems and the caregiver ecosystem, it is a crisis. In terms of the workforce shortage, misalignment of incentives, and a fundamentally broken economic model for many health systems. And so figuring out what are the technologies to drive better experiences, better, more scalability of the human labor of the people that are dedicating their lives to treating patients. It's something that we have to solve, and it is a key strategic priority for every one of our health system partners, of which we have 15. So that's something I think a lot about. Think a lot about the aging population, and there are a few different takes on that. One is finally having a dedicated focus on the behavioral health of the aging population, especially as we think about Alzheimer's and dementia, and the number of, potential patients we may have in that demographic in not too long of a time from now, and figuring out how do we identify this early? How do we treat with, empathy and dignity, and really focus on reducing that total cost of care, because there are so many downstream effects of an Alzheimer or dementia patient, not only for that person, but for the community of caregivers that is working with them. And we now have a life sciences partner internally, so trying to figure out how do we bridge that gap from the drug development side to the care delivery side. But that's going to take many, many years, but it's something we're really focused on. And thinking about that family caregiver workforce, it is a naturally occurring organic workforce that we have that is massively under-optimized and, sort of forgotten about in some respect. It's like, how do you enable that person to be compensated for the work that they're doing? Because it is a full-time job. How do you get that person the tools and the resources and, the economics deserved that align with how they're spending their day every day? And then lastly, I think I know we talked a lot about pricing transparency as it relates to drugs, but, with things like the No Surprises Act, thinking a lot about pricing transparency of, on the care side. How do we empower patients to make the most informed decisions as it relates to their health care?
Yes.
And we need an entirely new data infrastructure to be able to do that. So what are the tools that, we can be investing in to support that transition, which will be, a long transition, but there's a lot of innovation that needs to happen to support that. And once again, I'd love to get your take on it. I mean, I know you're so heads down in the day-to-day of your business, but would love to think what you think are the biggest trends for next year.
Well, I was smiling and nodding through so many of your comments because I couldn't agree more with so many things that you were saying. I was like, gosh, I was just talking about this morning. But I think some of the things or trends that I'm looking at going into 2023 and beyond is I think this is one of the first times in my adult life where I'm really getting a sense of, I hate to use the word, hope, of, not just transformational and evolutionary innovation, but I think in addition, I see, regulatory bodies, legislative arms coming together and really being thoughtful and, purposeful in their desire to help the end patient both have better care and reduce costs. And so I think one of the trends that we're going to continue to see in the current administration in many states is that you're going to see, and feel this kind of stronger advocacy, from the federal government and the states on behalf of patients across the United States, trying to make sense of this $4 trillion market, and how do they improve it? And I think that's one of the areas where I genuinely get a sense of hope, dare I say, because I think it is important, because, you know, I think all too often a lot of the reason why healthcare was overlooked for a period of time is that, you know, people just felt as if substandard care was their, you know, lot in life. That's all they should ever aspire or hope for. And I think also people just had somewhat given up. And I'm glad that in many ways the private sector has, you know, stepped up to create innovation, but I think it needs to be a bridge and a complement. And I do believe that members of the legislative arms, regulatory, even the press are getting involved in asking the right questions, because you're bringing questions to the forefront that maybe people were too scared to ask or didn't want to invest the time to be fair, because healthcare is so complex. Like, gosh, why do I want to understand the pharmaceutical supply chain and all the economic drivers there? So I think that's the, you know, the first one, you know, that real trend of the public sector catching up with the private sector on some level. I think my other kind of, you know, prediction for the future is kind of goes back to what I was saying, is I think the workforce has changed forever. And I think there are positive aspects of the change in the workforce, being hybrid, work from home, being able to draw upon more talent from more regions versus only being able to pull from the region your headquarter or satellite offices are located in. So I do believe that the kind of entire talent pool has gone national, at least in healthcare, you know, for us. And I think in addition to it, how we engage with our colleagues, how we train, how we promote, how we think to kind of next-gen leadership, you know, that's all going to have to be redefined on some level. But I think this is staying with us. I don't think it's going away. I don't think the genie's going to go back in the bottle to 5 days a week in a static location. I think the word must is being removed from a lot of conversations with employees. And I think there's, you know, a healthy middle ground of, you know, the balance that ensures highly efficient workforces coming together, but more importantly, you know, people can enjoy a little bit more time to themselves. So I think that's the other area that I continue to look at, is I think this is a path and it's going to continue to evolve, but, you know, what our colleagues are and what they're becoming and where we're headed.
Yeah, I couldn't agree more.